The OLIF procedure stands for Oblique Lateral Interbody Fusion. This is a minimally invasive spine fusion technique that we use mainly for the lumbar spine. The technique gives us minimally invasive access to the disc space without cutting any of the muscles or nerves. In any fusion surgery, the goal is to get the bones to grow together from one vertebra to the next, fusing the vertebra together into one bone. This is similar to getting a broken arm to mend and fuse back together in a cast. Because the spine does not naturally want to fuse, we use tools to stabilize the spine and stimulate the healing. Remember, the spine is made up of bones separated by discs and nerves going through the spinal canal. One technique of fusion involves removing the disc and inserting a spacer or cage to restore that disc space and height and provide structural support. Getting a cage into that disc space can be difficult from the backside because you have to go past the nerves without damaging them and place a skinny cage through a small opening. Going in from the side allows us to clean out the disc through a much larger window and put a broader, bigger cage in that space. It also helps us to realign the spine better. Unfortunately, it is not as simple as just going right in from the side and sticking the cage in. This is where the OLIF procedure comes in. We carefully spread the muscle layers to get into the abdominal cavity, and then we can gently pull the abdominal contents to the front and push the psoas muscle backwards. That gives us this diagonal or oblique approach to the disc space. We can then clean out the disc, spread the disc space back to normal, and place a large cage filled with lots of good bone graft and drugs to stimulate the bone growth and bone healing, and thus the fusion process. Typically, we will then reposition our patient and place screws in the backside using our 3D computer navigation system, again spreading the muscle fibers without cutting the muscles themselves. This method of OLIF combined with posterior screws and rods gives us a powerful technique to mobilize the spine, correct and improve the alignment, take the pressure off of the nerves, and lock the spine down for fusion. And we can do this with no cutting of any muscles and almost no blood loss. That way we optimize recovery and maximize long-term function. Here's an example of a woman with quite significant collapse of her disc between L4 and L5, with instability in the form of spondylolisthesis, which is where one vertebra slips forward of the other. You can see that here on the x-rays before surgery, where L4 is way in front of L5. After surgery, you can see the disc space has been opened up again and the alignment is much better. That's the power of the OLIF technique at restoring the disc space, disc height, and alignment. Using the OLIF procedure, we have seen a very, very high success rate for fusion and pain relief as a minimally invasive technique.